Hey guys, welcome. Let us discuss about febrile seizure. By this video, we are going to discuss about definition, etiology, clinical features, diagnosis, and management principles of febrile seizure. Let's see the definition. A febrile seizure is a convulsive event that occurs in infants and young children, typically between 6 months and 5 years of age, in association with fever, which is usually greater than or equal to 38 degrees Celsius, but without evidence of an intracranial infection, metabolic derangement, or a history of non-febrile seizures. Febrile seizures are not considered epileptic in nature, but rather an age-related phenomenon linked to the rapid rise of body temperature. There are two broad types of febrile seizure: simple febrile seizure and complex febrile seizure. When we see simple febrile seizure, these are generalized, last less than 15 minutes, and do not recur within a 24-hour period. Whereas complex febrile seizure, this can be focal, which means the onset of seizure is localized in the certain areas of our brain and are prolonged, which is lasting longer than 15 minutes, or recur during the same febrile illnesses, making them a heterogeneous group with somewhat different prognosis. Now let's see the etiology. The exact cause of febrile seizure is multifactorial, meaning the combination of genetic and environmental factors. While the presence of fever is the immediate trigger, several factors interplay in the occurrences. Infectious triggers. Most febrile seizures occur in the setting of common childhood infections like upper respiratory tract infection, otitis media, viral gastroenteritis. The rapid rise in temperature during these infections may precipitate a seizure. The other is genetic predisposition. A family history of febrile seizures or epilepsy increases the likelihood of that a child will experience a febrile seizure, suggesting a genetic predisposition. Neuronal hyperexcitability and immaturity. The immature brain in early childhood appears more prone to seizure activity when stressed by a rapid increase in neural temperature, changes in cytokines or other inflammatory mediators during febrile illness. Environmental and other factors, although less clearly defined, other factors like dehydration and electrolyte imbalances during acute illness may contribute to the seizure threshold. Together, these factors result in a transient window of susceptibility where the convulsive threshold is lowered due to fever and the associated systemic changes in the young brain. Now let's see the clinical feature. Presentation, as we mentioned earlier, the common presentation age is between 6 months and 5 years. Seizure characteristics, it could be simple febrile seizures or it could be complex febrile seizure. If it is simple febrile seizure, usually manifests as a generalized tonic-clonic seizure that lasts for less than 15 minutes and occurs only once during a febrile episode. Whereas complex febrile seizure may have a focal onset, last longer than 15 minutes, and recur within a short time frame within the same 24-hour period. So this is the clear demarcation between simple febrile seizure and complex febrile seizure. Thus, there is post-ictal state. After the seizure, children may appear drowsy or confused for a short period, but they typically recover quickly with no focal neurological deficits. The other associated fever, the seizure is concomitant with a fever, often noticed by parents, as there is a known illness like upper respiratory infection or other source of fever or other focus of infection. Family history, a positive family history is often noted, adding to the predisposition. Because these seizures are largely self-limiting and occur in a generally healthy child with normal development between episodes, the condition is usually considered benign despite the dramatic presentation. The diagnosis of febrile seizure is primarily a clinical diagnosis. The evaluation includes history and physical examination. On history, a careful history is taken to confirm the age range, the presence of fever at the time of seizure, and the absence of any central nervous system infection or prior non-febrile seizures. An assessment of a child's physical state, developmental status, and family history is conducted. Uh, the other is exclusion of intracranial infections like meningitis and encephalitis. So, before we are going to diagnose a febrile seizure, we have to rule out these intracranial infections. In children whose age or clinical features raise concern, especially those under 1 year or with signs of meningeal irritation, LP or lumbar puncture may be warranted to rule out the meningitis or encephalitis. In the absence of meningeal signs or if the history is clear, routine neuroimaging like CT scan or MRI and electroencephalography EEG are not recommended. Lab investigation, basic laboratory tests like blood glucose, electrolytes, and complete blood count might be performed to look for other causes of seizures. Example, hypoglycemia, electrolyte imbalances like hypo or hypernatremia, hypocalcemia, but these are often normal in isolated febrile seizures. The other lab investigation is urinalysis, which might be indicated if urinary tract infection or UTI is suspected as a cause of the fever. The overall workup aims to provide reassurance, exclude more serious pathology, and ascertain the specific trigger for the febrile event. So far, we have seen the definition of febrile seizure, the types of febrile seizure, the clinical feature, and the diagnosis principle. Now let's see the management principle of febrile seizure. The management of febrile seizure is divided into acute treatment, evaluation of febrile illness, and long-term considerations. So, on acute management of febrile seizure, safety and supportive care during a seizure ensure the child is in a safe position on their side to protect airway and prevent injury. Uh, do not attempt to restrain the child and insert objects into the mouth. The other seizure termination. Most febrile seizures are brief and resolve spontaneously without pharmacological intervention. But if a seizure persists, especially if it is exceeds 5 minutes, raising the concern of status epilepticus, a short-acting benzodiazepines like lorazepam or diazepam may be administered carefully under appropriate monitoring. The second one, management of fever and underlying illness. Antibiotics like acetaminophen or ibuprofen can be used to reduce fever and provide comfort. It is important to note that antibiotics do not necessarily prevent the recurrence of febrile seizures, but can make the child more comfortable. Evaluation for source of fever, identifying and treating the underlying infectious cause, like antibiotics for bacterial infections, supportive care for viral infections is essential component. The third one is long-term management and counseling, reassurance and educations. Parents should be informed that febrile seizures are usually benign and self-limiting, and most children do not develop epilepsy or long-term neurological problems. Guidance on seizure first aid and what to do if a seizure recurs at home can empower caregivers. Decision on prophylaxis. Routine daily antiepileptic prophylaxis is not recommended for simple febrile seizures because of the benign natural history and the potential side effect of medications. Intermittent oral diazepam or other short-acting benzodiazepines during febrile episodes may be considered in select cases. Selected cases means recurrent episodes, but this approach is generally reserved for complex cases or children with high risk of recurrence. So how to follow up? Most children with simple febrile seizure do not require extensive neurological follow-up. However, more complex cases might benefit from evaluation by pediatric neurologists, especially if the seizures are atypical or if there are developmental concerns. By combining immediate safety measures with a clear plan for managing the fever and the emphasis on parental education, the overall approach to febrile seizure is both supportive and conservative. On summary, the definition: febrile seizures occur in children between 6 months and 5 years of age during a febrile illness without evidence of CNS infection. They are classified as simple, generalized and brief, or complex, focal, prolonged, and recurrent. Etiology: the seizures are most often triggered by common viral and bacterial infections combined with genetic predisposition and the unique vulnerability of the developing brain. Clinical feature: typically, children present with a brief generalized tonic-clonic seizure during a period of fever. Complex seizures may be atypical features such as focal onset or prolonged duration. On diagnosis: the diagnosis is clinical, centered on history and physical examination. Investigations are tailored to exclude central nervous system infections or other metabolic causes. Management principle: treatment focus on ensuring safety during seizure, meaning managing the fever in underlying illness and educating caregivers. Prophylactic antipyretic medications are not routinely used for simple febrile seizures. Thanks guys.